We present case studies demonstrating how AI is being practically applied across different health contexts. So please join me in welcoming our panelists. We will have Dr. Readiness, the Director of Science, Information and Dissemination at the WHO in Europe. And we will have online with us Dr. Shadi Al-Barqawani. He's a professor of computational medical imaging research at the University of Rome. Previously, he worked as visiting scientist at Imperial College London and Zurich University as a senior research scientist and team lead at the Technical University of India. We also have online Ms. Yero Tan. Yero is the country implementation manager of Health AI. Currently, she manages the establishment of Health AI Global Regulatory Network for Responsible AI in Health. This included planning and implementation of work stream with the global partners and governments of AI innovation in health.
Allow me to introduce Dr. Iman Bad. Dr. Iman Bad is an associate professor of biomedical science at the University of Science and Technology at Kuwait City. She also serves as the director of the Bioinformatics and Computational Biology Unit. Dr. Iman has earned her PhD in computer science from Virginia Tech University. Dr. Iftikhar Ahmed is an AI consultant contributing to El Sarouj project and serves as a professor at the University of Europe for Applied Sciences. The panel is moderated by Mrs. Noor El-Arnaout. Mrs. Noor serves as the Associate Director of the Global Health Institution at the American University of Beirut. She's a certified project management professional from the Project Management Institute and holds a master's degree in public health at AUB with a specialization in health management and policy.
For staying with us today for this panel discussion. It's my pleasure to be representing the Global Health Institute at the American University of Beirut, who as moderator for this discussion. And the pleasure having you as panelists with us. Just to set the context for this discussion, we will be having a very focused discussion on advanced case studies regarding the use of artificial intelligence in health. So we have with us pool of experts who are from diverse settings. Some are policymakers, others are academic researchers, field-based implementers, technology development experts, and so on. And they will all reflect on how their institutions enabled or actually struggled in integrating artificial intelligence within their programming, within the healthcare system, within clinical care. So the way this panel will be structured, we will have a general question that will be addressed to all panelists. Each one is going to respond to the general question, and then we will have a specific question that is more focused on the expertise of each one of these panelists. So we will start with a general question to all of the panelists, and then we will start with order. I'd like to ask you briefly if you can reflect on how your institution is engaging artificial intelligence in health. So what role is artificial intelligence is currently playing in your work, and what are the opportunities and challenges you are facing and you see in aligning these innovations with your institution's broader mission and vision? So we can start with Dr. Iman from Zuwel City.
Thank you for the question. Thank you. At Wales City, we're actively incorporating AI in biomedical research and health innovation. For example, we have a biomedical sciences program. We have 4 concentration. One of them is computational biology and genomics. And in this concentration, what we're trying to do is to work on the intersection of biology and computer science to facilitate biomedical discoveries. And that's by using computational methods and artificial intelligence. Actually, in Zuel City, we truly believe in the power of interdisciplinary sciences. That's why AI is becoming one of the essential tools that we use for solving biological problems, utilizing this huge amount of data that is currently available. One of our main goals is to have helping researchers to explain and interpret complex biological systems but computationally. So that would reduce the effort and time we have in the wet lab. For my work as a director of the Bioinformatics and Computational Biology Unit, AI and machine learning are central tools for our projects. So we're currently working on diverse projects from biomarker discovery applications in cancer, improving the predictive analysis of immunotherapy, where what we're trying to do is to focus on utilizing state-of-the-art bioinformatics tools along with building our own machine learning models so we can extract new information that is not implicitly present in the data. We truly believe in multidisciplinarity, so we work across disciplines. We have active collaboration with different centers. So we're working with the Center of Genomics, directed by Dr. Mohammed Al-Hadidi, Center of Stem Cell for Regenerative Medicine, directed by Dr. Ramesh Al-Badri. So we can combine computational innovation along with biological discoveries. For the opportunities and challenges, so what is really exciting in Zuel City that we are not only working on research, but we're also trying to train the next generation of scientists that are working on these disciplines at the interface of computer science, data science, biology, chemistry. They are not working only on academic research. We are trying to improve patient outcomes. Having said that, definitely we have multiple challenges. One of them, I would say, gaining access to high quality data, real world data, especially from the public hospitals here in Egypt. I would say this is because of the lack of policy sharing, maybe that we don't have this interconnection. One other challenge, I would say, bridging the gap between the academic research and the industry adoption. On the technical side, I would say computational resources. That is still a bottleneck for us, especially if we're working with large-scale genomics data or imaging data sets. However, we're trying to overcome this with very creative solutions, but I would say that collaboration and support from other partnerships would make a big difference in that area. But despite these challenges, I'm very optimistic. There is a growing interest here in Egypt. AI, there is a momentum of understanding how AI can be transformative for health research.
Thank you so much, Dr. Iman. We can hear now from Dr. Arash about your experience.
Okay. Many thanks indeed, Dr. Noor. Well, I mean, if I want to summarize, I refer to some of the WHO strategies already. So I refer to the regional strategy for digital health, and AI program is part of that. There is also a bigger global strategy that is a guidance for WHO for acting in these areas. But I want to summarize in simple terms what we do areas. I mean, I can say 3 areas. One is that we're using the expertise of people like Dr. Iman to support the programs of the WHO to take it forward. So I mean, we use AI in sort of different programs. I refer to, for example, our emergency team are now starting to using AI for detection of new epidemics, so when happening. So we going beyond the traditional methodologies that we go for it, which we continue doing that, but using AI for a sort of quick process. I mentioned about my team working on AI, not sort of as a program with my responsibility for digital health, but as a use of it for supporting decision making for our program for evidence-based policy. And again, if we develop that, then we make it a program globally. There are many other examples happening. I mean, teams on non-communicable disease doing a lot. There is plenty going on in maternal and child health, and different teams. I mentioned about trial research, for example. And these examples, many of them are linked-based experiences coming, but also expertise. There is also what we call a community of practice, AI community of practice. One sort of professor of AI from the region is actually the host of it. That WHO has it on a sort of on a monthly basis. Everybody comes, people talk of their practices, etc., etc. So that might be good. Most importantly for us is that to support countries in terms of advancing the process. I mentioned about the role of ministries of health. From our point of view as WHO, ministries of health are responsible for the health of the public. So anything that affects the health of our public is their responsibility. So strengthening their capacity for being able to govern AI, use of AI, like any other technology that comes in, but also to predict how it affects the workforce, how it affects the quality of services, how it affects the trust in the system, all those elements. So that's part of the program that we do in terms of process. So that's the second part. And lastly, is development of norms and standards. So I didn't finish my slide set that I had, but I mean, sort of, if colleagues can share that with the audience, I mean, at the end of it, I had listed several documents that WHO has published on AI. These are norms about different elements of ethical use of AI, and cybersecurity and AI, different applications. And WHO works closely with other UN agencies. We are part of the global network for digital health. And even right now, there is a big meeting happening in Geneva, bringing different partners together. And so producing those guidance, and we do that at the regional level when relevant, but also using other works of the others and bring it to countries of the region and beyond for that purpose.
Thank you, Dr. Arash. Now we move to Dr. Iftikhar from Pakistan. We are already partners as part of the AI for Global Health supported by IDRC and FCTO, and we've worked together. So can you tell more the audience about how you've been integrating AI for global health in Pakistan and the region as part of your hub? No, you have to make it closer to your mouth and increase your voice level.
Is it working now? Yeah. Thank you very much. So I will provide first a brief background about myself so you can take some bit of context. I'm Iftikhar Ahmed. I work with AI Server project as AI consultant. And in my day job, full-time job, I work as a professor in the University of Cairo. And for AI Server project, I work with them as a consultant. So what is AI Server? So AI Server is a project that is funded by IDRC. And in this project, AI Server, we are funding further 9 sub-branches so that they are implementing various AI projects in the health of maternal and child health in South Asia. So we are working in 4 countries. We are working in Pakistan, Nepal, Bangladesh, and Sri Lanka. So there are a total of 9 projects. The goal basically that we aim for, when we were discussing this with our partners, so what we want. So our objective is, like one of our, let's say, colleagues told us that we would like to see that in the future, AI should be as accessible as it is. So everybody can use it. This is our vision for it. I know that this is quite, let's say, visionary as well, and this is quite challenging as well. But every journey begins with a single step. Okay, so we are trying to move towards that destination. We are far away from it, we know that. There are challenges, but hopefully someday we will do it. Now, in these 9 projects, what we are doing, so these are really diverse set of projects. So we are working, for instance, in Bangladesh, we are supporting a team who are developing a chatbot for adolescent health. So basically, they are working on generative AI. In Sri Lanka, we are supporting another team who are working on birth cohort study to identify, are they to predict multiple outcomes. For instance, the risk dependencies, or let's say some fecal problems, maybe they can identify from those data sets. In Pakistan, we are supporting two studies. In one of them, we are supporting the mental health. So we would like to predict the postnatal mental health depression cases using AI. In this case, conducted by our university, which was mentioned as one of the best universities who are doing research in this area as well. And in another project, we are predicting the gestational diabetes, which is again very very main and it's a core problem in the rise of the disease. So these are like widespread projects that we are supporting, and we have divided this project into two phases. The first is the development phase. In the development phase, we are focusing on developing these tools. So at the moment, we are funding these organizations, and they are at the development phase. So they are collecting the data sets. They are trying to come up with a model appropriate based on the requirements of these, and they are validating these models. So at the moment, these projects are still like in the development phase. In the next phase, we will go to the field testing phase. In the field testing phase, what we aim to do is to take these projects and move them forward in the field test to see how well they will perform here. And this is like the real challenge. Most of the time, because that's why I told you earlier that my background is in academia and I work as AI consultant. So in the academic setting, when we work in the laboratories, we get the data, we perform all those things, and we say, oh, at the end we got very good accuracy, we got very good recall, F1 score, historical ROC. These things are very good, specificity is very high. But when we take those things and when we implement it, so they don't work. So when we take them to the real world, they simply don't work. Like for example, there is this very good case study by Andrew Ng. I am sure some of you may already know him. He is the founder of Coursera, and he's, I think, associated with Harvard University. So in one of the interviews, he said that, okay, we developed a very good state-of-the-art X-ray system. Okay, so it was able to identify some diseases from the X-ray. Its performance was outstanding. Okay, so in one hospital, it was really performing well. Then we took it and we moved it to the next hospital. It doesn't perform quite well there. So they just move like in Hollywood in America. They move like one block away and they say it's no more working. So there are plenty of challenges that can arise. And we are looking into solving those challenges with our guidance and, let's say, support from practice. My time is running out. I got the message here. So I will explain that in my later part as well.
Thank you, Iftikhar. We'll have a follow-up question. Now we move to our virtual speakers. We have Vero from Health AI and Dr. Shadi from University of Bonn. We start with Vero. If you can reflect a bit on how Health AI has been working on integrating AI in your work as institution. Give us a minute, Vero, because we cannot hear you.
Example, very fun one, for example, and each of us meeting, the external student talk.
Yeah, so I am from AI, Global Agency for Responsible AI. So just to give a brief background, since in my first time about this organization. So we are an independent non-profit organization based in Geneva, and our core mission is to advance the development and adoption of responsible AI solutions in health. And to do so, we work with governments, multilateral institutions, and all other stakeholders to strengthen the capacity of national and regional bodies to regulate AI and health, right? So in a way, you can see us as an implementing partner to help countries translate those global standards and guidelines to something that's suitable for global context. So we position ourselves as a bridge, right, between normative bodies on one end and the regulatory bodies on the other. So normative bodies such as WHO, UNESCO, who sets global standards and guidelines for responsible AI and health. We at FAI do not create those standards. We also do not regulate the AI solutions ourselves. We believe in empowering the regulatory teams to be able to do so themselves through a collaborative approach. And the ultimate goal is to ensure that AI is not very safe, effective, and equitable, right, to improve the health and well-being of all. So going back to the question, when it comes to using AI in our world, this is something that we have been hearing quite a lot of regulators bring up as we talk to them. So this topic came up quite a lot recently when I started going to governments and regulators. This is something they are starting to explore. A lot of them are thinking of how they can use AI in regulatory processes to automate and expedite some of these processes. So for example, sorting through the market authorization process that's started by innovators and manufacturers, right? So at AI, this is also one of the areas that the team that our chief AI officers is exploring. But however, we need to be mindful and careful from the start, right? Because we are talking about regulations. So it's important to build a strong foundation first to ensure that the governance frameworks that are in place are effective, trustworthy, and suitable for the context of operation. There still needs to be human oversight and mechanisms in place to ensure that the final stamp of approval before the AI solutions go to market, right, is something that we can trust. So using AI in regulatory processes, I would say, is something we can see happening down the road, but now we focus on building a strong foundation first. Yeah. Thanks.
Can you ask Dr. Shadi to move
Oh, we cannot hear you in case you are muted.
Oh, thank you so much. Can you hear me?
She's asking.
Yes, yes,
Thank you so much. Yeah. So thanks for having me here. Thanks for Muhammad, and also Muhammad for also inviting me to this panel discussion, and also for Noah for the moderation. Well, basically, I'm coming from the University of Bonn. I served as a professor of computer science based on the University Hospital of Bonn. So basically, work with also clinicians to develop AI models in medicine or medical imaging. So our research focused on developing trustworthy, generalizable, inclusive, and interpretable AI models for medical imaging and global health applications. So AI basically plays a central role in our databases and the tasks that we are performing there, from automating the community diagnosis, tumor quantification, risk prediction, to clinical decision support system. And with a particular focus on the resource environments, where basically expert access is quite limited or probably rare. So we don't see it as a standalone solution, rather as an enabler for equitable healthcare. We do have a couple of projects for the region. So I do have a couple of partners in Lebanon, Egypt, Emirates, Iraq, Tunisia, and so on. So we do work on breast mammography, but also we have a couple of projects also with the African continent, so Burkina Faso, South Sudan, in Trachoma, and other also projects, ophthalmology, and so on. Nevertheless, there are a couple of challenges that we see there, because we are not only looking for solutions that are scientifically sound, but rather clinically deployable. This means there are a couple of challenges that we do see and we do have. Well, that range from like data bias, regulatory compliance, but also legal trust, right? And the way we try to address this by fostering and having interdisciplinary collaboration, open science, over we also give a high emphasis on educating healthcare professionals in the fundamentals of AI. And this is what has been reflected in a couple of initiatives that we have, where we basically developed and also ran a couple of summer and winter school, not only for students and graduates from computer science, but also healthcare professionals, where we also try to level up their knowledge in fundamentals of AI. Indeed, we have our recent initiatives called SANA, where we target also healthcare professionals coming from medical background, coming from specific countries according to the funding conditions from Iraq, Lebanon, and Tunisia. We will be having a summer school in September, and the goal is open, and it looks like we are more than welcome to apply and submit our application. So we cover also the application and travel. So what I'm trying to say, this is one of the things that we are basically trying to offer, and we truly believe this is the way to address this challenge, basically. So just to sum up, like the mission of our lab is clear to develop AI tools that are robust, fair, inclusive, and aligned with the real world, basically clinical needs, targeting also like low resource settings.
Thank you.
So let's hear if there's any other questions.
Thank you, Dr. Shadi.
I'll just move to this.
Hello. Thank you, Dr. Shadi and Yiro for your input. So before... So to proceed with our discussion...
Sorry, we didn't hear the narrator, so we know what's going on.
I think they're saying it's okay.
So before we move to the next set of questions that will be more focused on ethical use of artificial intelligence, it's worth highlighting a bit the portfolio of the Global Health Institute and the work we do as Institute on this work specifically. As Dr. Saleh mentioned, for the past 3 years, we've been serving as the regional hub for the use of AI in health and for global health in the MENA region. And as part of this work, we're trying to support researchers and innovators across 6 countries in the MENA region, including Jordan, Morocco, Qatar, Palestine, Lebanon, and Turkey, to actually design and implement or even come up with solutions that aim to improve health outcomes and that are based on AI. But the focus of our hub is not only AI, it's actually focused on the use of responsible AI, right? And many people do not actually have a full understanding about what responsible means. And this is the notion that we are trying ourselves also to enhance our understanding about it. So when we talk about responsible artificial intelligence, we're talking about AI that is ethical, that is inclusive, that is human-centered, gender-sensitive, We're talking how we can mitigate the biases that are usually embedded in AI models and algorithms, and we are continuously engaging in these discussions. And part of this work, we are creating a community of practice where we will be engaging with different entities, different experts, and interested individuals in this conversation, and also compiling resources from policy institutions, from research and academic institutions, from implementers, from technology companies, to support the work on the use of responsible AI to improve global health. So with that said, we're going to move into a more responsible AI-focused discussion with the panelists, and I'm going to start with Dr. Shadi and Jiro. So Dr. Shadi, you work at the front line of AI model development. Can you hear me, Dr. Shadi?
I think he said yes.
He can? Okay, so Professor Shadi, you work at the front line of AI model development, primarily in the clinical setting. So how do you ensure your imaging algorithms are generalizable and equitable, especially when working with data that may not represent global diversity?
Yeah, thanks for this is a great question. So we are trying to ensure like first generalizability in medical AI, because it's one of the pressing challenges we do have with AI medicine, basically. So I can summarize the approach in a single word, guide, and then I will just go through the letters of the guide. This is like the summarizer approach. So G basically stands for the Global Cooperation in Data Diversity. And this is something that we give high emphasis there, where we actively cooperate across not only Europe, but also across the continent to collect and evaluate models on diverse data sets that capture the political and demographic variability. It's worth mentioning that this variability is not only coming from the demography, but also, scanner variability. Scanners also have this kind of sort of variability as well. The amputation from the physicians and also the ladies. This is all source of variability that we're trying to bring with this kind of diverse data sets. So nevertheless, basically, we were not able to collect this diverse data sets. We do have also a technical approach with domain adaptation and first techniques to basically mitigate this issue. The U in guide is uncertainty quantification. It's one of the quality control basically that we are trying to deploy and have it embedded in our AI models to flag any cases when predictions may not be reliable, basically. And what we do also, we routinely audit the performance across some population to detect and see if there is any, some sort of biases there. I and guide stands for inclusive feedback loop. So we oftentimes, we most of the time basically work with clinicians. I do have also a clinician in my team where we work closely with them, get their continuous feedback from the design basically to the deployment to ensure the models are basically relevant, understandable, and usable in practice afterwards. The D in guide stands for democratization, AI through education. This is what I just referred to in my previous first part. We are trying to engage healthcare professionals in these educational modules that we develop to basically empower them to responsibly integrate trust and also criticize the AI models, basically. Last but not least, the E stands for ethical integrated learning. And this is one of the research aspects that we work on, the research teams that we work on, is how we could build collaborative machine learning models across different sites, institutes, across also the continent, that respect the patient privacy, and of course, like also their data, to allow the model to be trained without compromising the data privacy. So this is something also we were working on. In particularly with the low resource settings with, also like the affordable resources. So basically this guide framework, I would just call it, it enables us basically to develop this AI, or medical AI algorithms that not only technically sound, but also, ethically sounds globally relevant and also human-centered.
Thank you, Doctor. Thank you. Dr. Shadi, are you done with your intervention or are you still talking? Okay, thank you so much. And as you said, it's not only important to ensure that the AI models are ethical, but also it's important to ensure their relevance to the context where they are implemented. So that's a very important note you make. Yero, given that you have experience in working with governments, entities, and other stakeholders in various countries, what are the main challenges that you are facing and that you think are hindering or slowing down the adoption of AI or the scale of responsible AI solutions in health?
Thanks a lot, Norm. So yeah, we are talking to countries around the world. This includes countries from Asia, Europe, Middle East, Europe, and also South America, right? And one of the main words that we often hear is trust, or on the flip side, point fear, right? So I would ask the audience to think back to when we hated building twice when taking a paracetamol. So whenever you ask this question, most people will say no, right? Because you trust that the pill is safe and can be used to be replicated. But when it comes to AI solutions in health, that might not necessarily be the case for now. Most people are waiting it out because they do not fully trust the technology yet. And if you think of the technology adoption curve, right, or the diffusion of innovations model, a small percentage of people fall under the early adopters, and majority of the people fall under early majority or late majority group, where they are more cautious and pragmatic. So they will only adopt a new technology after it's been proven to be reliable and useful by early adopters. So human behavior is a complex study, but if I were to use one word to answer your question, I think it would be fear. So what we're hearing is fear is slowing down the adoption, but how do we gain trust then? So I will start from the end user perspective, right? Effectiveness and safety are the top two priorities to them, especially in the American domain. We need to ensure the responsible use of AI in health. And when we say responsible AI in health, it is not just about the regulations, and it's not only the government's responsibility to ensure the safe and effective use of AI solutions in health. So we believe that it is important to involve diverse stakeholders in this conversation. So everybody ranging from researchers, innovators, private sector, as well as civil society and patient associations should be part of the conversation. So when we talk about AI governance in health, right, we see it more like a spectrum, right? It can go from the regulated end, where governments can implement hard laws and legislations. It can go to the middle ground, where there can be guidelines and standards being put in place. Or it could also be the unregulated end, right, where stakeholder education, awareness, and communication play a key role. So this is what we call the duality of AI in health, right, which we at Health AI do emphasize that it is important to not just think about the regulated part of responsible AI in health, but also the unregulated part. So let me maybe give you an analogy here to make it easier to understand. Right? I always like the analogy of the cars and the roads, right? If you imagine the cars being the AI technologies and the roads being the guidelines in place to ensure that the cars stay on course, it's not only important to have the cars built the right way, which is equivalent to the development of ethical and responsible AI solutions in health, we also need to have the roads built well, which is equivalent to having regulatory mechanisms in place, right? But we also should technologies in health. They are also responsible in terms of using the technologies only for its intended purposes. So it's like you don't expect a lorry to be able to race like a sports car, right? And accidents, which is equivalent to the adverse events, may happen if you, for example, like you drink and drive, or if you speed. If you use the technology not for its intended purposes. And then this brings me to also another point that I want to highlight is that a lot of people think that regulations slow down innovations, right? We often hear that in discussions. But from our part, we would like to argue that it's actually the contrary, right? Because regulations and innovations can actually go in parallel, and they should go in parallel. So it's like looking at roads in cars, right? Without proper roads, the cars will not be able to serve their intended purpose of transport. But looking in parallel, we can ensure that AI solutions which are developed can be trusted by the people, and this can increase adoption and facilitate the scaling of AI solutions in health. And one of the points of end users and regulators, right? So what are the innovators? Another factor which we have been hearing about to innovators that's slowing down the adoption and probably the scaling of AI solutions outside the countries where it has been developed, right? Is the lack of communication and transparency between stakeholders. So what we are hearing is that the different stakeholder groups, they do not communicate. For example, the innovators are unclear about regulatory processes. They need to go through to receive approval of their AI solutions to go to market. So oftentimes it is not the regulators, it's not the regulations that are slowing down innovations. It's the lack of clarity and communication about the processes. So we believe that it is important to build an ecosystem and establish community channels between different stakeholder groups. This then helps to ensure that there is a clear pathway to market and bringing clarity in what the steps are needed for innovations to be approved to market. Just to end off here, I want to highlight something that might be of interest to the audience here today, and also relates back to my point about building an ecosystem, right? So at Hub AI, we have set up a community of practice where we bring together diverse stakeholders. So on top of our work with governments and state regulators, we also bring together researchers, private sector, academia, and also civil society and patient groups on a common platform to discuss important topics related to responsible AI and health. So for example, in the past months, we have talked about generative AI, regulatory sandboxes, and what responsible AI means, right? And in general, we talk about topics which our community members are interested about. So if it's of interest to anybody, this skill is open to all institutions, and you could visit the Hub AI website if you're interested. Thank you.
Thank you. Thank you, Yiro. Thank you, Yiro, for your input. One main aspect that you discussed is trust. And a lesson that we have learned from our work in the use of digital health and AI for health improvement, specifically in underserved communities, is that an aspect to increase trust in the communities and the AI models we are using and the digital health technologies that we are implementing is to actually engage the communities and the beneficiaries in the actual design of these solutions and the implementation of these solutions, and later on in testing the effectiveness and evaluating the impact of these solutions. So if we engage them from early on, it will make a lot of difference when it comes to trust. And from here, I'd like to ask Dr. Iftikhar, from your experience, what are the practical lessons that you have learned for the integration of AI in primary health care or in rural and underserved contexts specifically that you can share with the audience?
Thank you very much. So as I said earlier, we are working on 9 projects, and most of them are in the low resource settings. So they are in care in those settings. So what we learned from, so if you want to undertake such a project, how you should play, like what should be your strategy, what are the pitfalls that you encounter and that you should be aware of. So I will mostly focus on that. So the first and foremost is the project management. Okay, so if you want to do an AI low resource setting, then use a software management tool, etc. Okay? Do not rely on paper documentation, do not rely on Excel, etc. I mean, Excel is good, but if you are good, strong enough for that, okay, but I will strongly recommend to use a proper software project. So what we did, we developed an in-house tool for it, and the learning that we get from it is like very, very rich. Okay, so this is number one. Basically, when say computer science, it was zero, as we started from zero. So number one, then there is the Murphy's law. It states that anything that can go wrong will go wrong. Okay? So it means that you should not have only plan A, you should have plan B and plan C as well. Because trust me, nothing will go the way that you want it to go. If there will be hurdles, if there will be things that may not go well, you plan, for example, data collection for 3 months, okay, it's going to take double the time. Okay, maybe not double the time, maybe slightly majority, maybe at least 1.5 times more than this. So please plan ahead for it. Right? Then we always say that data is king. Okay. You have heard it like so many times. Right? Data is king. Of course, that's true. But I have slightly different version of it. I say data is Caesar and Judas. I'm sure you know about Julius Caesar and Julius Caesar, right? Okay. So what does it mean? Data is king, there is no doubt. So that's why data is Caesar, Julius Caesar. But a bad data, okay, is of no good use. So if the data quality is not good, okay, you are going to get a model that will not detect the reality. For instance, in one situation, right, the data that was collected initially, it was really good quality data. Like all the variables were available, okay, because it was some pre-collected data that they were using, that one of our project we were using there. But after this, like in the next phase, when we went there, we were trying to like adopt it or use it in the real world. Okay, we observed that most of this data, it doesn't match what we were already using in the training phase. So there was, let's say, a lot of diversity between the data that was used in the training phase and the data that we are able to collect in the real world. So plan ahead for it. Okay? Please always use the data, or always look out for the data that is representative, that represents the diversity of the population, that represents, let's say, the overall structure of the population, and all the contextual, let's say, relevant information that our model is going to operate in the real world. So that's a very important lesson that we learn from it. The other is community co-design. Okay? One of the hurdles in technology adaptation is the behavioral change. If we do not onboard people who will be the eventual end user of it. For example, if we are developing something for community health workers, most of the time we develop them without taking them on board. So we develop a tool for them and we say, okay, now go ahead and use these tools. It does not work like this. It did not work like this. Okay. So try to take them on board at the very beginning. Try to understand how they do it in the real world. And then transform them into AI solutions or AI products for them. Then, don't go for fancy models. Like you will often learn from people that generative AI, ChatGPT, chatbot, etc., vision models, right? I mean, these are fancy terms. But should we really use them? So maybe in some context, okay, they are really, really beneficial. Like deep learning is really beneficial. If we are working with terabytes of genomic data, it really makes sense. But if the data is really limited, okay, we can hardly collect, let's say, 20,000 data points. Should we really go for vision models or really, let's say, deep learning models? They require a lot of computational resources. And then we cannot deploy them, okay, in low resource settings. So the thing is that, I mean, it does not make sense always to go for state-of-the-art models, right? Maybe a simpler model will really do the job better. But the important thing to consider here is that whatever model we choose, it should work in the specific circumstances and under the specific set of constraints that we are going to face in the real world. So this is a very important consideration. If you are working on generative AI products, okay, so some of the times we say, oh, let's use ChatGPT for it. OpenAI is providing us an API. Okay? Gamma is providing us an API. Right? There are many others as well. Do this, etc. In one of our projects, we try to use them for, let's say, if we were developing a board, then we use that. Okay? Because they are not specifically developed in the local context. For example, you are using it in the Bangla language, which is spoken in Bangladesh. But I mean, it's very good. They are very good in English language. But for Bangla language, they had their limitations. So it took us really extra time to get the data in the Bangla language and adopt these models based on our model environment. Right? And afterwards, the validation of these models is even difficult. Like if you're talking about generative AI, let's say chatbots, etc. Everybody's like saying developing chatbots. But the validation of these chatbots is difficult in the development. So a lot of efforts and concentration should be devoted to that. For instance, you can Google about it. There was a recent incident in which a family sued an organization that was developing a chatbot. Why? Because their child committed suicide while the child was interacting with this online chatbot. And the family thinks that the chatbot is responsible for it. So there are so many things that can go wrong. Some time.
Conclude.
Okay, right. So I will conclude. Like there are so many other points as well. Okay. Basically, I'm a professor as well, so I talk long. I'm sorry. I'll just give you like 1 minute. I'll just share a very recent story. When I landed in Egypt, so I was told, I said, okay, how I can convert euros to Egyptian pounds? And I was told, that, okay, go to the bank in Misr, ATM, and you can do it there. I went there. On the first day, I exchanged 50 euros. And then everywhere else, the card was used, so I was quite happy. Yesterday, I went again, and I tried to convert another 40 euros. I put the euros in the ATM, it processed, it made a beautiful sound, and at the end, it took the euros, and it refused to give me the Egyptian pounds. It gave me a test that your transaction is rejected. I said, okay. I went there, and I asked the person, what can I do now? He said that, oh, sorry, we are not responsible for it because this is Bank Misr ATM, okay, but we are not Bank Misr, they installed it here, so go to Bank Misr. I went there, luckily it was like only 15 minutes, since they were closing. He looked at it and he said, is it like the same ATM here? He said, no, it's another one. He said, no, but we are not responsible for it because it lies outside our jurisdiction, we are only responsible for this one. Now imagine, who will take the responsibility if an AI will make a mistake? Right? Will it be the developer? Will it be the implementer? Will it be the owner of the company? So this is one of the hurdles that we can see as we are developing AI solutions. I have more to share, but unfortunately time constraint. I will end it here. Thank you very much.
Nice example. Thank you so much. Thank you so much, Dr. Iftikhar, for sharing this story and linking it to the discussion. It's very interesting. So, Dr. Arash, you have spoke a lot about what WHO has done previously. Now, moving forward, what is the plan of WHO in engaging the member states in deploying responsible artificial intelligence? What role in terms of capacity building is it going to play? And how are you going to foster cross-country learning about this regard?
Many thanks indeed. And so, in a way, it's in line with a lot of the discussion that was mentioned. Because, I mean, if you think of all the dimensions that previous speakers highlighted, so then when we talk of fostering capacity and response, then you need to address all of those, and you need to consider all of those. And when we talk of those, I mean, it becomes response, many elements come into it. So one area of work that we work very closely with the countries is health information systems. So we're developing systems for data, et cetera, et cetera. And while doing that, usually in ministries of health, we are engaging with the IT teams as well as the health information teams. And often they are not the same team. So there are different specialty, different backgrounds, etc. So with the concept of sort of digital health and AI, that role becomes even augmented. And then that capacity becomes really important. So for us, continuing what we do, but expanding on that to make sure that it goes ahead with more capacity, that's really important. And when I say capacity building, it's not just what WHO does. So let's say if another institution, let's say AUB, is doing some capacity building, from our point of view, that's institutional development. And those programs, bringing them together becomes absolutely important. But again, we need to also bear in mind, when we talk of this capacity building, it's not just about those people who are directly dealing with these issues. First of all, AI is more or less everywhere now without you realizing. So almost every search you do in any engine without you wanting it, there is an AI element comes into search. Some search engines make that very visible, saying that this is the AI summaries. Even if they do, you are not sure whether they've used AI in the background for that or not. Many of the devices that are now being introduced to the market of health service delivery, they may have some AI things at the back end that you may or you may not be aware of, and all the health information systems coming. And if, let's say, the data system in the countries of the region are not that effective, that means the feeding of examples that you mentioned are really relevant to that. The feeding that helps the AI to understand the context is not relevant to the context that the AI is applying to that. We've seen that in sort of measuring outcomes, but then you see that much more in terms of when it comes to giving advice for what would be the decision and interpretation. So, I mean, in terms of the capacity building element, also part of it is the other thing you need to bear in mind, scale is quite huge. Let's say, now with one of the smallest countries of the region, I don't highlight the name of the country, but I mean, we are discussing in the finalization of the national strategy for digital health. The lowest estimates for capacity building for that country for digital health would be in millions of dollars, while the sort of in terms of the number of services provided is very, very limited. Even within the same country, so when you go from different elements, the capacity is different. So I visited that country, went to one hospital, public sector, which was very limited, going to another public hospital, but not belonging to the Ministry of Health. The capacity was technically quite advanced. And then maybe it should become how to make sure these are well distributed going forward. So a lot of the work from deputy side we do is not just about sharing examples, actually making sure the system as a whole works. And part of that becomes into the governance decision, capacity building decision. I know what I'm giving are sort of scattered examples of how to bring that forward. But again, think of it. Let's say decision-making processes for, let's say, medicines, for adverse events. There is a lot of AI role and AI contribution right now happening in those areas. Again, when we talk of capacity and also sort of enabling institutional capacity, those become important. So overall picture is needed. AI cannot be looked at in a tunnel vision. I mean, it's an area of interest. When we had the last World Health Assembly in Geneva, not the one this year, in 24, so there was a session on AI. And I was glad that one of the ministers from the region talked in that AI session was not the Minister of Health, but the Minister of Innovations, I think.
Yeah, Innovation or Technology.
From UAE. So very eloquent talk about how we can do further on AI. And AU is a very well advanced resource on that area. Making those elements into actions, again, becomes a shared responsibility. Again, universities. So several countries of the region do not have a strong academic background in informatics. If the background in informatics is not strong, moving to capacity for AI would be extremely difficult. Again, those cornerstones should be strengthened, and that's something we advocate for and take it forward. So I stop here for the sake of time, but if there is further question, I'm happy.
Thank you, Dr. Arash. And to complement what you have been saying, it is a clear observation that you have made that it's not a one-size-fits-all when it comes to capacity building for the use of AI in health, because there's a huge variance across different countries in the MENA region. So we're talking about very advanced technologies in the Gulf that are being implemented, while other countries are way back in terms of existing capacities and the need for capacity building. So that's definitely something to keep in mind. So to wrap up this discussion, and given that we are in Zuwail City, I will end it with Dr. Iman. So Dr. Iman, we saw and learned that many of you as professors in Zuwail City, as educators, you are trying to integrate the use of AI in building the capacity and training the next generation of scientists many of whom are here with us today. So how are you ensuring that there's sort of a balance between training and innovation and responsibility? And how are you nurturing this mindset of responsible use of technology and AI when it comes to implementation sciences?
Thank you so much. This is a really important question. So I believe that our goal is not only to equip students with technical skills in AI, but also to develop this mindset of responsibility. So I'll be focusing more on academic settings. For example, we're trying to find this right balance between innovation and responsibility. So I'm teaching a course, it's data science and genomics. Some of my students are actually here. So on the other hand, we're providing all the theoretical foundation and hands-on experience to work, build and experiment with deep biomedical data, developing cutting-edge models, developing the pipelines, and encouraging my students, especially if they are involved in research labs with the city, to work on real biomedical data and develop their own frameworks. But on the other hand, I'm asking them to critically examine the models they have built. So questions like how these data was collected, identifying confound factors that could affect the model behavior, how factors like bias, sample size, imbalance in data set will affect the model output. This limitation is very essential, understanding this limitation to build an accurate model. This is very important for us. We implement some of the responsible AI practices, developing these models. For example, external validation. So I would ask them to have external cohort data set that they can assess the generalizability of the models they build. Another practice we would do is interpretability. It is very important not to have only a model with high performance and great accuracy. It's very important to be understandable to the users. Whether they are microbiologists, physicians, clinicians, radiologists, it is very important for them to know how the model will take these decisions. So all of these are practices to build the trustworthy AI. So I'm always telling my students that AI is assistive tools. It is not a decision maker. So we only here to support the clinical judgment, not to override the judgment. This is very important. That's why we also, again, we are working across disciplines. We see AI as a technical tool that can be totally integrated with the disciplines, and students can actually see the impact and consequences of what they do on real-world data.
Thank you. Thank you so much, Dr. Iman. And there's a very popular saying now that says AI will not replace humans, but humans who are using AI will replace those who are not. So we will have a couple of minutes dedicated to taking questions from the audience to the panelists. So if you can please assist us in giving the microphones to those who have questions. And for the attendees, if you can just say your name and organization and address your question to the panelists. Take this way.
This is Dr. Shabi. Currently, I'm freelancing. I'm the excellent care project manager for cybersecurity manager. My question, in the context of decision-making, informing the decision-making process and the end user using an AI model who is not technically expert in the AI. So how should I evaluate from your discussions? You have emphasized on the validation of the AI models is really hard. So for the end user, with AI models coming to the market for sure, how could I assess if I can use this model rather than the others? That I could think that this model would be subscribe based as not subscription based. So it's also related to the economic resources, the monetary resources. So how will they evaluate this as an end user from that decision making, informed decision making perspective?
Dr. Iftikhar, would you like to answer that? Yeah, the mic is there.
And I can follow as well.
Sure.
That's a tricky question.
Is it up? Yes. Yeah.
Again, it's a tricky question, to be honest. Okay? How do we say that, okay, this, let's say this model, let's say ChatGPT, Gemini, Claude, which one is good for me? Perplexity, there are many. Okay? Which one is good for me? So there's no straightforward answer to it. Okay? Because sometimes there are no independent studies, okay, which can evaluate how good or bad these models are. There are studies, okay, to some extent identify, let's say, hallucination in those models. Hallucination means that something that does not exist and the model just comes up with its own. Okay, so it's called hallucination. Right? So unfortunately, there are no independent studies which can validate all those models. Okay, so basically what these organizations are doing, they are producing the models and they are validating them by themselves. Okay, they say that only our model is, in terms of accuracy, we are better than this, okay, in terms of performance, these things. But the lack of transparency is again another problem in this. Okay, so for end user like me, if I'm going to decide, so what I do, okay, that for example, when I'm using it in software development to assist me in writing code. Okay. So before I make subscription, I go for a trial and I ask it some 3D questions. For instance, one time, like it was a year ago, okay, I asked ChatGPT, I should not name it, but it's named it, I named it probably. So I asked it to write me a code, okay, now in Python language. So what it did, it wrote me a code and it imported some libraries that are not non-existent basically. They were not there. Okay, it said import this library. Okay. Then it said that got a particular function and this function does not exist. Okay. So I thought at that time that no, this particular subscription is not good enough for me. Okay. So that one way as a user for us is to try and validate it. Unfortunately, there are no, let's say, gold standard against which we can evaluate it at this point.
Dr. Arash has...
Many thanks indeed. I mean, it's a really important and real challenging question at the moment. So the point is also, let's take it to the health sector. So let's say, when we assess whether a technology is better or it's a solution, whatever solution is better than the existing ones or answer, we look at the outcomes. To look at the outcome, we need time, we need application in reality. We design randomized controlled trials. We follow the situation. In AI processes, the risk is that usually the time you take to take that answer is longer than the time for the AI to develop itself. So in a way, by the time you know whether this is good or not, the company might tell you, well, I mean, I've changed that already, so there is something better to come forward. So in a way, that's difficult to judge. The other thing, which is, and I'm saying that I'm sort of, this is a major consideration. And a lot of the claimed benefits are against the known expectations. So if you do not know what's going to happen, then that's difficult. So, but if you go for deep learning, deep models of AI, so if it's specific, then you look at this function. So for example, I'm diagnostic accuracy, and then I use this against that one, so it's make it better, interpretation better. So yes, I'm sure, don't change it that much, but that can be used. But if I go for a sort of decision-making support, in a way, what you expect from AI is more than that. So bring elements that you are not aware of, things that you didn't consider. And judging that benefit is absolutely difficult. And at the moment, because your standards might require to change. Right now, the examples I gave for critical thinking is based on 50 years of experience in epidemiology on how to assess the validity of a finding against the other. But should I expect also AI to tell me whether those methods are the best one or should be improved or not? And again, with the models behind AI, many of them are proprietary. The details are not well known to the person who is not behind that machinery. They may not be shared with the evaluator, etc. Judging those becomes extremely difficult. So a real question, there are ways to do it, but at the moment, the methods we have are actually more focused to answering quick questions rather than to addressing the main challenge that you highlighted.
There's an input from Dr. Shadi. So, Dr. Shadi, if you can, Dr. Shadi, if you can hear us, you can say your input.
So we don't hear you. You're saying something.
Dr. Shadi. Okay, we have one more question from the audience. So. وبعدين انت ولا يلا تفضل.
I can get.
Yeah.
Please do.
How realistic is the dream of achieving representativeness in AI models given the current lack of data infrastructure and the top-down support that we have in most of the Arab region? It's a race that's going so fast that by the time we sort out these problems, the models that we will probably be using, if we use them, and I know there's another problem with trust, we might not even adopt fully artificial intelligence in our processes. But if by the time we sort out our problems, the race would have been so much advanced that we're not going to be able to catch up. Are we ever going to achieve actual continuous representativeness, and what we need to do to sort of fast track it if we
So
have
who
a
would like
chance?
to answer this question? And yeah, but briefly, please, because there's another.
Okay, I have just one line of answer for it. Okay, there is a saying that unless the lion, okay, Asad, I think in Arabic, the lion has learned how to ride. You will only read the stories of the hunters, right? Okay. So I mean there is disparity. Okay, there is misrepresentation of certain facts, or maybe certain historical or representation. So the idea is that we, let's say, the developing world should be able to develop their own models, to develop their own systems, okay, based on their own data set, indigenously. They will be the solution to such problems. Very good.
So I would say to achieve this, it has to be across different aspects, from one of them through universities, one of them through government, one of them is through funding agencies. But I would say that there is a growing interest in artificial intelligence and how to implement this in Egypt and maybe on the region.
Yeah.
I know we have a very loud voice, so I'm going to whisper in one. So, my name is Sharif Abu Hadid. I'm from the London School of Biotropical Medicine and Leiden University. And basically, it's beyond shadow of a doubt that AI is actually integrated, basically coming to be integrated to basically virtually every sector. The question is here about the ethics of AI in terms of the energy consumption and how this actually might affect our planet. We are just basically, there's a tool for using AI in terms of energy consumption, water usage, and so on and so forth. So are we actually harming our planet? If there is any kind of restriction of using AI, if there's fascination on the hype of AI, just basically override its environmental concern? That's my question.
Very interesting spin to link AI to the
I'm all for
environment.
AI, I'm not against it.
however you see fit to answer.
Well, I mean, I'm not expert on the topic, but I see the challenge exactly as you said it. I mean, the AI machines are extremely energy-consuming approaches. I mean, that was why, for example, when DeepSeek came, everybody was positively happy, saying that it's a more efficient in terms of energy-using approach. But the reality is that even if there's lower ones coming, because everybody is using it even more, the energy consumption going up. We see that in other sectors as well. That's a big, big risk. And this is a risk that we are not publicly discussing very well. We are not bringing that into the dilemma of the benefits and challenges. So even if you think of the devices, so I mean, again, I come from the health sector part of it, the devices that you would bring in, there will be other opportunity costs for bringing those in, and there will be other approaches. That's the major question. I totally agree. That should be part of every decision-making process.
Thank you so much for our audience to engage with us in this discussion. Thank you for our panelists. We can continue this discussion outside for the networking. And thank you for attending this session. There is a workshop session following the lunch. So for those who are interested to join the workshop session, the team will guide you where you can join them. Thank you so much. Thank you.
So just one closing remark. At the end of this session, I would like again to thank everyone who helped in organizing this event, all our partners, the Global Health Network, the Global Health Institute and the American University of Beirut, Health AI Kharouche, the WHO Emiro office, and the Canadian University in Dubai. Also, I would like to thank all the departments at the whole city, the EP office, the engineering department, the security department, and the communication department, as well as the IT department. Special thanks to the engineering and the IT department for all the effort in helping with the logistics in this event. Last but not least, I would like to invite my team here on the stage, all the team in the CG team and the Teaching Effectiveness Office team to be on the stage here. Can you come? All the postdoc, the grad students, the undergraduate students.